Okay, good morning, everyone. It's really great to see you all. I know there was probably stiff competition between coming to this forum and going to the beach, so we're really pleased that you've chosen us. A huge endorsement. Some of you may not have met me before, so I'll just briefly introduce myself. So my name is Keith. I am the new Chief Exec of the Voluntary Action Camden. I started back end of last year, but I would say because of Christmas, I probably started in January, and it's been great. I'm really pleased to have joined VAC, and I've been really enjoying the conversations that I've had with many of you, and yeah, I'm particularly pleased that we have these forums which were really popular during the pandemic, and it's great to be able to bring them back and yeah, have the opportunity and space to network and discuss and to share learning. So thanks again for so many of you for joining us. This is an opportunity for us to share how and why the integrated care system is partnering with the voluntary sector to tackle health inequality. It's also an opportunity for us to explore going forward what the role of the voluntary sector and the role it can play excuse me, in helping to tackle health inequalities in neighbourhoods, places and integrated care systems. And we're really pleased and grateful to be joined this morning by Joe Reeder, who is the Head of Integration and Borough Partnership Development in Camden. And Joe will be talking to us about the importance of neighbourhoods and the role the voluntary community sector in the North Central London integrated care system will play. We were hoping to be joined also by Lizzie Stimson, who is the Senior Engagement Lead at NCL, but truly justifying her title, she has another engagement. However, we've got a perfect replacement in our very own Donna, who is going to share Lizzie's slides on the draft NCL CCG strategy on working with the voluntary community sector enterprise. In my relatively short time at VAC, I've had the pleasure of hearing from some really experienced system leaders in the NHS, local authority officers and the voluntary community sector about how cross-sector collaboration can and is driving health improvements for local people. And it will be really great to hear some of those examples during this forum. And we have planned to provide that space at the end for people to share and discuss what's happening in their area and what they're seeing in their area. I wanted to just go through briefly some housekeeping. So unless you are speaking, please mute your microphone. I think it might automatically have been muted. But if for any reason it doesn't, it goes off mute, please do mute it unless you're speaking. For those that are eagle-eyed, they'll see that I have a black eye, and for the past few days I've been keeping my camera off to save people from looking at it. It's a sports injury, by the way. But it would be great to see everyone, especially when you are speaking. So yeah, if you can turn your camera on, that would be great. Please do make use of the chat if you have a question or comment. I can't promise that we'll get through to everyone, but we'll try our best. And we're not, because there are so many people that have joined today, we're not going to go through and ask people to introduce themselves. But if you would like to, please do use the chat to say who you are, where you're from, and your role. There will be intervals throughout the session where you can ask questions, and I think some of the presenters are happy for you to raise your hand during their presentation and ask them. We tend to record our forums, and we've started recording already, but if you prefer not to be recorded, please do let us know. All our recordings are posted on our website, which will become available shortly afterwards. We will aim to finish on time, but if you need to leave beforehand, that's fine. We will circulate all the slides after the meeting. And then just lastly, this is a shameless plug. I think we've got over 60 people that have been booked onto today's forum, which is amazing, it's fantastic. if you're not yet a member of VAC, please do visit our website to find out how you can join, and of course get invited to many more of these fantastic events. So I think that is it from me. I'm going to hand over to Donna.
Right, I'm just going to reiterate what today is about, really. So it is really an opportunity to understand the integrated care system and where the voluntary and community sector sit in that, really. So Joe is going to explain the entire system and then I will talk through Lizzie Stimson's voluntary, working with the voluntary and community sector and social enterprise sector strategy, and then some of the work we've been involved in developing a voluntary and community sector alliance at the system level. Hopefully what I've said will become a bit clearer as the sort of session goes on. While Joe is speaking, if you do not understand any of the terms or concepts, do raise your hand or ask. But if it's ideas or comments or more general questions, can we keep those till the end, please? So we have an hour and a half for this session, so we don't want to rush things. The important thing is people gain some kind of understanding and take away some things to think about how we move forward as a sector, a voluntary sector in this. There are a lot of other people on the call who are involved in the system building. So if they have points to add or they can help to answer questions, please do butt in and raise your hands when it gets to that opportunity. And on that note, I'm going to hand over to Joe.
Thank you. I wasn't sure if Ricky could share my slides. I can try myself, but I'm not very good on Zoom. It's not my natural system, but I'll just introduce myself while the slides are coming up. So thank you, Keith and Donna, for the introduction, and no pressure that I'm going to try and explain the entire integrated care system across North Central London. So what I can't see. Oh, can people see the slides now? Like I said at the beginning, for some reason my Zoom is split between two screens, so I might have to look that way, so apologies that I'm not looking at that. So if I could have the next slide, please. Thank you. So this is hopefully an attempt to try and explain the big wholesale change that's happening across North Central London, which is our 5 London boroughs and or previously 5 CCGs that have come together across North Central London, with Camden being the one that I work for, where I live, most passionate about, but this is what we're here to talk about, Camden, but we do have 4 other boroughs within our North Central London system. And I'm going to use the word system, and it's not, and as it says on here, it's not an organisation, it's just a way of working, and actually our move towards being an integrated care system. This is about joining up the NHS with itself, because that's also a complicated area. So I'm sure you'll understand there's our current CCG, a clinical commissioning group. We've got GPs, we've got community pharmacists, we've got hospitals, we've got community providers. So it's about integrating the NHS. It's about integrating with the local authorities, for us, Camden Council. It's about integrating with our community and voluntary sector, which is really important, but also how we can work better and integrate more with our residents and people that use services within Camden. So I might use the word system, and I mean it's all of our partners across North Central London. And within that, we have 2 main, one organisation change and 1 partnership within the system. So again, I'm sorry, it takes a little while to explain, so apologies if you know what I'm talking about or if I'm not making sense. So what we're having, the biggest wholesale change at the moment, which is happening, is the establishment of what's called the Integrated Care Board. As of the 1st of July, CCGs across the country will no longer exist. So familiar language, clinical commissioning groups, will not exist as of the 1st of July due to a new legislation, the Health and Care Act. They will all become an ICB, Integrated Care Board, which is a new word for CCGs. And that's where you'll have maybe familiar people like our existing chief executive, being Francis O'Callaghan, will be the chief executive of the Integrated Care Board. And that's the NHS commissioning part of the ICS. What's most exciting and innovative and different is the establishment of the Integrated Care Partnership, which is a real partnership of local authorities, our community and voluntary sector, our NHS colleagues to really shape the strategy for North Central London. And that will be where the big decisions will happen across the 5 boroughs, where we can make efficiencies and do things once across, but also establishing brilliant things like the VCS Alliance, which I know Donna is talking about, or what we're calling our Provider Alliance, which is our big hospital trust that exists across North Central London, coming together to make decisions about North Central London rather than who uses the Royal Free or who uses the Whittington Hospital. It's about them coming together to look at how we can improve the health and care of our populations in North Central London. So CCG becomes the integrated care body, but it's the partnership we're talking about. And there's a big partnership at the NCL level. And within that, there are partnerships at each borough level. And so today I'm here to talk about our borough partnership, our Camden Borough Partnership. Some people that are familiar for this might have heard the term place, and that's what exists within North Central London. We have 5 places which map to our 5 boroughs. For other integrated care systems, it doesn't map so neatly, and they've had to create places within their integrated care systems. But we're very fortunate in London that we have fantastic local authorities to work with, and particularly working with Camden. And then because we love to have another layer of delivery, but this is the most important layer of delivery, within every place, or what we're calling borough here, there are neighbourhoods. So it's a smaller unit of delivery within the Camden Borough. And I'll talk a bit more about neighbourhoods as I go through my presentation, but that's really where we can make a difference to people's health and care and really start addressing our long-standing inequalities in Camden is actually at that neighbourhood level. And what's really key to all of this is partnership working across all the partners that I've mentioned. Can I have the next slide, please? I'm not going to go into a lot of detail, and you will get the slides after this because I've sent them to Donna so they can be shared. But this is just to talk about the fact that there's been a lot of change happening at that ICS level. You may have heard language before about North London Partners in Care. You might have heard about previously the Sustainability and Transformation Plans, the STPs. So this is all coming together with this legislation that's gone through all of Royal Assent and changes to create this new integrated care system. And really what's been happening in the background from that legislative perspective is to start to break down that previous legislation which created commissioners and providers and a bit of a split, and actually not really delivering the best for people that live and work in areas and use services. So there's been a long journey to get to the point that's going to happen on the 1st of July. Can I have the next slide, please? And as part of all of this, there's been a lot of government white papers and legislation and all sorts of rafts of guidance coming out from all sorts of places. But the most interesting one and the most important one has been the most recent integration paper, which really does focus on borough partnerships, or as places they call it, so Camden, being able to make decisions. So as you'll see on the right-hand side, there's a few milestones in that legislation, but actually there's an expectation on places going forward that there will be a single point of accountability within place, someone that will be looking at the health and care and delivery in Camden. So you've got your big ICS setting the strategy, but the delivery will happen within Camden, and we make decisions at a Camden level. That by 2025, we have to have a population health platform, but by 2026, which I don't know why that's on there, there will be an establishment of a delegation potentially of functions and budgets, or aligned and pooled budgets, to place level. So we could really make a difference at Camden. What we've got to do over time now is get things right. And what's really important at this stage is building our relationships and our partnership. Why it's fantastic to come and speak to you here today, because actually you are a key partner in what we're trying to deliver. So we have the next slide, please. So the ICB, which will become in effect on the 1st of July, has set out some really important principles for the way they're going to work across all of North Central London. And the most important ones are the ones that I've highlighted here in red, about improving the way we work with communities and actually embedding co-design with people. That's the fundamental principle right at the top of everything that's happening. And that's exactly what we want to be doing in Camden. And that really continued focus on boroughs. This is something that is going to grow. The role of our borough partnership will continue to have influence, and will influence up into the ICS as well as out. And that delivery unit within the boroughs is neighbourhoods, which I will talk about in a bit. But I just wanted to highlight here that everything we're talking about that's happening at Camden level is sponsored by the Integrated Care Board and Partnership. And I know if this is complicated language, and if I think about trying to explain this to people, I think I get it, and then I get a bit confused about what we're trying to do. But what we're not doing is recreating the Camden CCG, which a number of people will have worked with before. This isn't about recreating a CCG. This is about creating an integrated partnership in Camden to shape what we're going to be doing going forward. Can I have the next slide, please? So this is hopefully showing for you what the difference is going to be across NCL. So previously, the CCG was very health service focused. It was very much about looking at contract monitoring. Is this service delivering what we want to do? We are the commissioner, you yourselves and others are providers. And actually what we're looking at doing is having a real population health approach, having a collective responsibility for what it is that we want to do. So rather than partners coming around the organisation and representing who they are, it's about representing who you are in your organisation, as well as representing Camden as a borough. It's about, like I just said, they're moving away from that organisational focus to working together at place and neighbourhood level. It's moving away from being the ICB as a contract enforcer to enabling things to happen, collectively sharing challenges, collectively looking at where things might not be going right or well for people and how we can work together to make improvements. It's about convening collective decisions rather than previously the CCG being the decision maker. Actually, it's about moving towards listening and understanding solutions from outside of the CCG, which I know previously hasn't always been in place. And it's about moving away from the CCG monitoring progress to the ICS, ICB and partnerships and neighbourhoods, sharing accountability, sharing an understanding of performance, rather than being, that's not happening over there, what are you going to do about it? It's like, this is not working, what are we going to do about it? What can we do? Now, I recognise this is a lot, this is whole scale system change, this is culture change, but actually we've got a chief executive in Francis who's very supportive of doing this and really championing the role of boroughs and neighbourhoods in delivering this change. Can I have the next slide, please? So let's focus on Camden. So hopefully, I know, I appreciate I've gone through this quite quickly and we can have a lot of discussions and conversations afterwards, and we can have, you'll have the slides as well. But we've got that big ICB, which is the new word for CCG. We've got our big integrated care partnership, and we all exist within our integrated care system. What we're here today to talk about is our Camden Borough Partnership, the Camden's role within that ICS. And so it's about, currently our Borough Partnership is focused on transformation. Some of you maybe haven't been involved in some of the programmes, but I recognise there's a lot of work to do to get towards that point in the next few years of Camden being a decision maker and a convener and actually holding functions. So currently I've listed here who our partners are in our Camden Borough Partnership. So we've got the council, we've got currently the CCG, which will be the ICB, we've got VAC, we've got Health Watch, we've got our big hospitals, we've got what's called primary care, which is our GPs, our primary care networks, and as things change, we'll have sort of dentistry and optometry, and we've got pharmacy, and we've got a patient representative. But I recognise there's a lot more to do to make our partnership more inclusive and more representative of our borough, and that's the work that hopefully we're doing with Donna and Keith and VAC and organisations. But we're also driven by the council's health and wellbeing strategy, and what we're trying to do at the moment is align our work, because previously you would have had strategy here, strategy there, CCG, local authority, all this kind of thing. So through our alliances, like the Voluntary Sector Alliance that you'll be hearing about later, and our Provider Alliance and our GP Alliance, we're looking to pull that together so that there is one strategy, single versions of things, because once we've got those strategies, it's our job to then deliver them and see what we can do. So there's a lot of work happening at the moment to develop the Borough Partnership, and I'd like to sort of, well, when we get further on, we have questions, talk about how we can keep people updated, get people involved in things like that. But so that's what we're talking about today. Can I have a next slide, please? So this is our structure of our Borough Partnership. Right at the top, you'll see that we've got the Camden Health and Wellbeing Board. Now, that's a really important role here in terms of setting that strategy, looking at the health and wellbeing strategy, And also there's a real clear link and a follow through, and that's something we're improving, which hasn't always been as well as it could have been. And then we've got our Local Care Partnership Board, which is a wider meeting, similar to the Integrated Care Partnership Board at the top. That's a Camden version of that board. Again, there needs to be some work. It's been in place for quite some time, so we probably need to do some development work. And we've got our Camden Integrated Care Executive, which is where the execs from all of our organisations come together to look at what we can deliver. And what we're looking at the moment is how we can evolve our current structure into what it needs to be in the future. Is it ready? Is it mature? Could it hold a budget? What would we do? Where would decisions be made? At the moment, all these groups are shadow groups because they don't have a governance structure, because that will come over time. And then within that, we've got a number of what we've called focus areas, which is the areas of transformation that has been tested to see what it takes to make our partnership work and effective and integrated. And the most important ones that I'll be talking about, and this does need updating because they have come together, is neighbourhood working and community connectedness. And they are really important areas. Like I said right at the beginning, neighbourhoods is where we can make decisions about health and care for local people at a neighbourhood level. And community connectedness is really key because we want people to feel and be more connected to their neighbourhoods, to their local communities. And that's where there's a really strong role for community and voluntary sector within that. Can I have the next slide, please? So what is neighbourhood working and community connectedness as part of that? And it's like I said, it's all about people leading the way, people shaping the way that we deliver and support people in their local community. It's about empowering people. It's about improving people's experience. It's about looking at our enablers of integration. What does it take to make people come together and to work together? And it's about the physical and practical integration of healthcare, community and voluntary organisations to work proactively, to be more preventative, to look at a population focus for things, rather than at the moment where we have, for example, people who have multiple long-term conditions being in multiple pathways, and actually seeing people as people first. It's about being more personalised, being more proactive and preventative. But in order to do all of those things, we have to work together and make decisions about what that looks like. And we have to make that decision with local people and local organisations. Have the next slide, please. So what are our neighbourhoods? So as you'll see on this map, at the moment we're working with 5 geographical neighbourhoods across Camden that map to these titles. So there's NW3, East, NW5, Central and South. And so at the moment within those neighbourhoods, there is a facilitative lead who is trying to organise things within the neighbourhoods. And we're at the moment putting a bit more structure around neighbourhoods, but each neighbourhood has a nominal lead who's the coordinator of tasks. Within that, there are neighbourhood meetings, and they're establishing a neighbourhood steering group. Each neighbourhood is at a slightly different level, but some of you will have been involved in neighbourhood meetings and some of you might not have been, and that's a space today to talk about that. But actually, it's really about trying to establish what is neighbourhood working. It's not a team at the moment. It's about understanding what can we do different within the neighbourhood. So elements like improving understanding what's available in the neighbourhood, looking at social prescribing, looking at understanding roles across who works within a neighbourhood, which is the beginning unit. So we have to develop relationships and partnerships first. The beginning of unit of then being able to make those decisions about what needs to happen in neighbourhoods. There's a lot of work to do, but it's a really exciting time to be involved, because this will be where change will happen. This will be where we'll be able to think about what we want to deliver and improve across Camden will be within these neighbourhoods. So early days, but at an exciting time to get involved. Can I have the next slide, please? So this is a lot of words, I recognise that, but again, you'll be taking it with you. But really, the neighbourhoods are looking to achieve an awful lot, and that's why we need as many partners as possible to be involved, because it's about that integration of health and care. So about that, physical, multidisciplinary working to improve the way we work with people, but it's also about improving information and support. It's about community connectedness. It's about people feeling connected to their local communities. Improving friendship, which I know is a really important part of the Camden Health and Wellbeing strategy. It's about people being active members of their community, and actually the support that people might need to be able to do that. And as it says at the bottom, it's a really important opportunity to address and hopefully reduce our existing health inequalities across Camden, because actually that's where we can make change and do things differently, and really work proactively with yourselves to see what aren't we doing well, what needs to be different, how can we make better for the people that live in Camden. So I know I've sort of gone through an awful lot of information, but if I can summarize that, we've got a legislative change happening with the NHS. We've got the dissolving of the clinical commissioning groups across the country. We have the establishment of the Integrated Care Board, who will be making those big health contract decisions. But the most important part of our new ICS is the Integrated Care Partnership, which is a real partnership at an executive level across all of North Central London to look at how we can do things better. Where are there things that we can work with our big acute hospitals on our provider alliance, which will mean that we have got more capacity to do things differently at the borough level. And within each borough, and that this is the same across all of the boroughs across North Central London, is about then what do we do at a neighbourhood level? How do we work better with people more locally to really improve people's health and care? And then where can we use resources differently? Where can we look at what we're doing and make some big changes and decisions about what we want to do across Camden? It's all early days and it's all a lot to do, but we can do it, because actually what I've realised across Camden is we have fantastic organisations like yourselves that are here, really great relationships to build on, some fantastic work. And actually some of this is about giving people knowledge and understanding of what we're trying to do, that as and when we get increased responsibilities, that we're ready to be taking that on. So I think that might have been my last slide. Yes, so that was just questions, but we can maybe take that afterwards, Donna. It's up to you how you want to do the next bit.
Oh, off mute, yes. Yeah, there's we've got a list of questions that have been building up in the chat. So perhaps we could go through those first, directly after the presentation. Then perhaps if people want to, we'll keep those questions on the screen if people want to think about those. So the first one we've got here is how is the patient representative selected?
So at the moment, because of the way the current CCG is in place, we have patient participation groups that are linked to primary care. So at the moment, that is the current patient representative, but I appreciate and I know that is not good enough, and one person cannot represent everybody. So that is an area that we need to work on, definitely. So at the moment, that's who our patient representative is, because our local care partnership board has been in place for a number of years, and it's an area of work we definitely need to improve. We've been working with our chair of the board and our current informal co-chair about how we can make changes, and we're working towards an ambition of having a local resident as a co-chair of that board over time. So we need to do a lot of work. So that is a challenge that we are aware of, what we need to do more of.
Okay, so we've got next, users of hospitals in London probably have experienced frustration of patient data not being shared across some hospitals, depending on which trust the hospital is in. Will the Integrated Care Board have an integrated IT database system across NCL?
Yes, that is absolutely an ambition over the next few years. I personally experienced that. I'm under a consultant at one hospital, but then I had to go to something at UCLH. And I've got 2 different patient records, let alone my GP record. I know the frustration of that there's no read across. There is within the Thriving Places slide, which I probably should have highlighted, there is an expectation there that there will be I know we've all heard this before, I appreciate that, but there will be a single health and care record in place, I think within the next 4 years. But there is a move towards doing stuff at that level. I know, for example, in North West London, they've got a much better joined up system. So yes, that is something the Integrated Care Board are looking at. And I know pan-London, so across London, there is work in that space around something called the Urgent Care Plan, I think, which is the beginnings of what it takes to bring information together. So yes, there's an expectation across the country, but I know at an NCL level, that is something that they are looking at doing, because it is very difficult having your information in different places and then professionals not being able to see it, let alone yourself having to manage it. So yes.
A budget question for you. Is the North Central London budget bigger, the same or less than the sum of the 5 boroughs within it?
I'm not sure if I understand the.
I suppose that relates to the current borough budgets. Henry, you asked that question. Do you want to clarify that? Oh.
Yes. Well, at the end of the day, money drives everything. So will NCL has a bigger budget, the same or less, than what the 5 boroughs operating separately are doing?
Okay, oh, I see. I understand the question now. Apologies, I didn't get it before. But I mean, it's not something I have the answer to. But what I do know is that by bringing together all of our partners, the budget is fundamentally different. If we think about the large budgets that are held within organisations like the Royal Free Hospital, there's a much bigger budget than we've had before. So at the moment, they're looking at all of the budgets across the integrated care system to see what that looks like. I don't know the answer to what that will look like for each borough, but I do know they're looking at it from a population perspective in terms of the allocation of budgets. But I don't know enough about that, but I can find out and pass some information on. But I know that as they establish the new organisation come the 1st of July, one of the first things they're looking at is budgets.
Thank you.
Next, there's a question from Becca. Becca, if you want to come on and ask the question, it's about where public health fit into the model and addressing broader socio-economic, systemic and structural factors affecting community health and well-being.
Yeah, thank you. Nothing really to add to the substance of the question. I found it interesting that when we're talking about collective ownership of health and well-being, obviously there are considerable socioeconomic, structural and systemic factors that affect our community's health and well-being, and public health being a big part of that, and a public health approach to addressing some of those Michael Marmot type social determinants of health and well-being. So I was just wondering where they fitted into the model. Thank you.
And absolutely, Becca, and I apologies if I didn't put them on the side of the partnerships, but public health and our director of public health actually sits on our partnership board and is really integral to what, like you said, our population health approach. So one of the things they're looking at an NCL level is a population health outcomes framework, which is quite broad, but looks at those wider socio and economic factors and what we can do differently. And the expectation is that each borough would then look at that and see with their directors of public health what that means for their borough, what we need to look at for Camden. And so, yes, for example, we've previously had, just a small example, we've had, some of you will be aware, we've previously had health inequalities fund projects. And actually, if and when we have another wave of those projects, we are going to be much more focused on population health, on public health, of looking at where we really need to work, rather than who puts their hand up and who, for example, I know a number of primary care practices and GPs came forward to deliver that work, but actually we need to be much more targeted and we need to be looking at where we do things differently. A piece of work we're working on at the partnership at the moment is around workforce, so working with the economic development team in the council and Good Work Camden, and actually looking at the fact that we've got large number of people that could benefit or are looking for work. We've also got large hospitals that have vacancies, so doing some Camden-based work to join things up, but actually doing supportive work, seeing if we can change the way that we do job descriptions, change the way that we are working with people, looking at our flexibility, improving the way that we our terrible job descriptions in the NHS, for example. We're looking at areas like that where there is a lot more we could and we should be doing, and we are being supported by public health in that space. And we've recently, as part of the partnership, have a dedicated public health, I think she's not a consultant, I can't remember what her title is, but to work with us on our borough partnership development.
Neighbourhood working is important, but there are organisations like the Helios Centre that work across London, for example, with people living with HIV, and they feel they tend to get missed out with the focus on neighbourhoods. Are there mechanisms for integrated care partnerships to work together across London on specialist care services?
Yes, there are. So that is where we're looking at things like, so the idea of doing things at bigger levels. So like when I talked about the shared care record, actually to do that across London makes the most sense. And with specialist providers, there is an expectation of work happening across London. But you're right, we do need to be mindful of what that means for larger organisations at that more local level. Also recognising that some of your organisations here will work across all of Camden's, therefore, and if you only have a small number of employees, how can you go to all neighbourhood meetings? So we do need to do some work in that space. And that's why it's really helpful to come here for us to think through what those levels are as they establish and how we can work well together. And a lot of this is about how we ensure that things that are happening at a London or an ICS level filter down to Camden, but also think and to neighbourhoods, but also think about how neighbourhoods filter up, but seeing them as kind of an align. It's not, there's not a hierarchy here as much as I'm doing this because one is bigger than the other geographically. It is about us working together. It is about neighbourhoods being as equal to places, equal to the system, and recognise that we work across London. So there's some support we get, from example, from the London region, but there is more we need to do in that space. And I'm more than happy to have conversations. For example, I didn't catch the name of the person that posed the question, but I'm more than happy to have conversations there about helping us think and challenge our thinking and challenge the way that we do things, so we can make sure we're working, because I recognise not everybody works at each part of the system.
Yeah, that question was from Lloyd at the Helios Centre.
Okay, well, Lloyd, I'm more than happy to have a conversation with you outside of this, how we can think about what we do in that space.
Okay. The next question is, how are refugees and asylum seekers involved?
Involved in the borough partnership? Is that the question?
Ruth?
Yes, that's me, Ruth. I was wondering, because you've got VAC covering all the voluntary sector. I think that's quite a big ask, really. I think that will probably agree with me. You've got, in the plan, you've got all the hospitals, the GP practices, etc., a lot of NHS, but for the voluntary sector, you've only got VAC, which seems to me to be undermining the voluntary sector. So I agree with Rashid when he said that some of what you have already planned is going to displace what is happening at the moment with the voluntary sector. And also, I wanted to say that in your hospitals, you haven't included the Whittington, and that is part of Camden as well as Islington. And your map of all the neighbourhoods gives Northwest 3, including Highgate, which is N6, and right over the top, which is not Northwest 3. Northwest 3 is a very small part of Camden. And I think to label that large area as Northwest 3 is a bit confusing. Also, the part that you've labelled East neighbourhood is actually west of the borough. So I'm not sure who set this plan up, but I don't think they know Camden very well. So that's the second part of my question.
Well, I mean, I'll take that last part first. I might have put the wrong neighbourhood map up. Apologies. I didn't draw it. But at the moment, I think it was just trying to split up Camden as best we can, but recognising that there's probably quite a bit of work to do there. So apologies if it's the wrong map and it's the wrong way around. And as I said before, the partnership isn't perfect and needs work. And that's part of coming out to this meeting and coming to other organisations, is to think through, who are our partners? How do we do this? How do we get people more involved? Where do we need to go and think and do things differently? And so I've come here for questions, challenge, thoughts, because actually that's exactly what we need to do. We haven't got it right. So there's more we need to do. We don't work with the Whittington as what we call a strategic partner. They work with Islington, but they do work across NCL. So we work with the Royal Free and UCLH because they are geographically located, but recognising we also have Tavistock and Portman. We have Great Ormond Street as well. So it's about working out who are our strategic partners, but recognise they also cover larger areas, international centres. So we are working on
the Whittington includes a large mental health constituency, which would be left out if you're not including the Whittington, because the mental health crisis house is in Lewittington, and I deal with asylum seekers. I don't know where they're going to get access in this setup, so I think that needs to be rethought. Asylum seekers and refugees need more input.
Yeah, thanks, Ruth. So take this last question that's in the chat, then as we're getting into the voluntary sector sort of stuff, and then we can move on to the next bit, which might answer some of the other questions. Rashid has posted this question. How are you seeking to proactively identify, explore and strengthen existing neighbourhood initiatives? There's a risk you end up superimposing a less useful structure or displacing community-led activity based on what appears to be an orthodox programme management governance arrangements. Rashid, do come in if I haven't reflected that well enough for you.
I think I'm just curious as to, because we've been through several processes around this, because I think we've done stuff in Kentish Town and other places, also in parts of Camden, where we've had quite expensive consultants come in and tell us that the solution to community dividedness or community lack of information is to put it news boards or notice boards, or to have places where people can go to find that information out, like community centres. So we've had some really kind of cheap-flow solutions to kind of quite complex systemic answers based upon superimposed initiatives that haven't really stopped to pause and discover what's happening on the ground. And I'm just curious as to whether or not this has been driven by a sense of, let's populate this structure because that's how change programs are managed. We have a board and we have yada yada yada. We have a couple of representatives, or whether or not there's a kind of proper discovery phase that's built in from the bottom up, from neighbourhoods, from streets, from communities upwards, and then to build around that. Otherwise, for my organisation, the amount of money we've had from the NHS over the last 5 years is zero. But we zero every year, cumulative amount is zero. But our three key strategic themes currently are mental and physical health, community togetherness, and inequalities, including poverty, racism, etc., and many of the things that Becca's touched on. So just curious as to how this is going to play out, Joe, whether I'm to expect a visit from you and your team so that you can discover, or someone, or whether or not you're going to ask me to come and spend more of my time get more people about the work that we do.
So I guess, Rashid, to answer your question, we're trying to do both, which is never an easy solution. So we're not getting necessarily right. So we do have our program structure because, I'm working in NHS for one better term. We just love a program structure. We love to have boards and people come together and papers and slides. So we've got that part because we do have those current accountabilities and responsibilities, and that's how we're running that part. We also have the development side, which is our work with the council. And I think Jessica might be on the call, she might be able to answer this a bit differently, which is the wider neighbourhoods. So we've got that programme structure. And in particular, if we're looking at the practical integration of health and care and what that means, what computer system we need to share records, what training do we need for our workforce, which will have a programme structure to it. We've also got the bigger part around neighbourhoods, that development, that relationship building, which is the work that council colleagues have been leading with the organisation Traverse, who some people might have been part with, which is about that discovery phase, is about understanding what we need to do to make neighbourhood working happen. So we're trying to do both and maybe failing both, but we're open to conversations and discussions as part of that, because there's a lot we can do, but also there's a risk, exactly what you said, Rashid, that we are either replicating what's happened before, missing lots of things, or not really hearing people. So we're trying to do both, but I am always up for a challenge of how we can improve things and do things differently.
I've never heard of Traverse. Oh, I've heard of Traverse, but I've never heard of an organisation called Traverse. So I haven't moved for the last 4 or 5 years. So when people will know, you'll know we're not easy to miss in NW3 or East or West or whatever you're calling it.
Thanks. So I'm going to move on to the voluntary sector bit, the working with the voluntary sector strategy that Lizzie has given me the slides for, and the work we've been doing around the idea of a voluntary sector alliance, because it might actually sort of fill in some gaps, but also will pose more questions and hopefully stimulate some ideas. So Ricky, could you put Joe's presentation in the chat along with the other two? Then people can actually download the presentations as we go along, because we might then want to come back to those other, there are other questions we will come back to. So I'm going to share my screen and start with the, can everybody see that? No,
Yes,
yes. And okay, so I'm not going to dwell on every slide here. Sorry, I've just opened that up by mistake. The North Central London ICB have developed two strategies. One is working with our communities and the other is working with our voluntary and community sector. These are different, but they do connect and they reinforce one another. So VAC has been involved with our counterparts in the other 4 boroughs and a different equalities group from each borough, working alongside this, developing a steering group for a voluntary and community sector alliance. So the strategy has been developing in parallel, and I would say that's pretty true of a lot of what's going on around the development of the system. Things happen in parallel, so there's not a sort of necessarily a sequence of events, work out the structure, then do that next bit of work, etc. It happens in parallel, it's quite dynamic, and it is quite a learning process, but it's useful in a lot of ways, but it can appear to be extremely messy. So the strategy the draft strategy that has emerged for this, and I'm focusing on the voluntary sector strategy, not the community strategy at this point. This is the sort of background, but
sorry, Donna, just to interrupt, I think people are struggling to see your screen. Can you put it in the presentation mode?
yeah, okay, sorry. I thought that might happen. Okay, can you see that now?
Perfect.
Okay, so if you can see at the bottom here, I mean, this is the important next bit, really. It's the delivery plan for these strategies that are, and for us, the voluntary and community sector delivery plan of the strategy is going to be an important bit. So some of the information we've taken to this has come from these forums. Some of you were here 18 months ago when we looked at, we had a session called Why Neighbourhoods Matter, and there was a lot of feedback. It's all on our website, so all that stuff was fed into how this developed, really. So this is the sort of vision that NCL have to embed the voluntary sector, and then for each strategy there are a set of principles, again concentrating on the voluntary sector stuff. It's well, hopefully people will recognise we've got quite a lot in there around sustainable funding, capacity and support, investing in community-led stuff. The actual strategy as it stands now, and those have been circulated, the 2 draft strategies. So there's this bit, which is structural, developing the North Central London Voluntary and Community Sector Alliance, and a strong network of voluntary sector VCSE, that's including social enterprise, just in case anybody wonders why that E keeps appearing on the end. The alliance across the 5 boroughs then is there to support what happens at the borough level in terms of embedding the voluntary sector and the voluntary sector's ability to engage with the things that are going on. So yeah, the descriptions of how the North Central London system want to work with their voluntary sector. The approach, lots on collaboration, sustainable investment, investment in preventative and strengths-based approaches. Well, that's voluntary sector, you know, USP really. And then supporting an infrastructure and resources and expertise that really make this possible for the sector to work within this system. And that's really, I don't want to dwell too much on these because these are not my slides, and but it gives you an overview of what North Central London have as this draft strategy for working with us. And at the moment, we're feeling this is quite positive. And then finally, there's something on evaluation. So this will be in the chat, so you can look through it in your own time, but you should have the strategies. I'm going to try and switch that back now to my other. Wow. Okay, so this in parallel is what the voluntary sector, what we've been doing as the voluntary sector CVSs. So the voluntary sector alliances are really, they're happening across the country, and this is sort of part of the NHS England sort of strategy. NAVCA, our umbrella organisation, have been working closely with NHS England around how this works really, and supporting it with examples and good practice from across the country. So in North Central London, we're part of a third cohort, so there's a lot to learn from out there. So these are the 5 infrastructure bodies across the North Central London system. This is what NHS England have to say about the voluntary sector, embedding the voluntary sector with the integrated care system, really. So it's all sort of positive stuff. So the reality then on the ground is, as what we've done is we've come together as a steering group. We've now recruited 5 different equalities focus groups into that steering group across the 5 boroughs. So the Alliance has been developing together with the strategy for working with the sector, as I mentioned through Lizzie's slides. And the idea of this steering group is that it is there to support what happens at borough level. And as Jo has already explained, the system it's not this sort of hierarchy thing. It's hierarchy of sort of decision making or whatever. It's the system across the 5 boroughs is there to provide support and vice versa to the individual boroughs. So what happens then in each individual borough will be appropriate to what is needed there. So as 5 CVSs, one of our first things was that we wanted to keep things quite fluid and flexible. We don't want to have to be constantly being called up to talk about things that we don't really have the expertise in. So what we want to do is to have it understood that we are there to be able to bring in other people from our voluntary sectors who have the specific expertise that, for instance, might be needed on a working group, that kind of thing. All this stuff is sort of being thrashed out at the moment. And very particularly being able to bring the voices of groups that don't usually get a look in things like this, which is, I think, quite ambitious. And that's because this is covering such a huge sort of geographical area. So on that note, I've tried to squash it down into a few sentences that kind of, I hope, illustrate where the voluntary sector can engage and for what purpose. So I've put neighbourhoods at the top because, as Joe has already said, this is really important stuff. The whole system is dependent on this strong foundation of idea of a strong neighbourhood offer where residents are really supported in their health and care and well-being near to where they live. And so at neighbourhood level, which is probably of, and I mean neighbourhoods sort of as a concept really, rather than pinpointing specific neighbourhoods. But this is where relationships are developed. This is where people can build collaborations and support residents most effectively. What we're doing at the North Central London level, the system level, really, with the Voluntary Sector Alliance, is looking at how we develop the infrastructure to make that happen. Now, in the strategy, there's stuff like changing commissioning so that the voluntary sector find that accessible to actually work together across different sectors and be able to deliver great stuff for residents. So there is quite a lot that probably needs to change there. The way, everything, I think, from the way sort of opportunities are circulated and communicated to the way that organisations and groups can both work with the statutory sector and actually make sense of some of those contracts. So there's a lot about resourcing and capacity, building capacity in the sector that is very infrastructural, if you like, that kind of opens the doors for all the organisations that are delivering fantastic stuff to support residents, so that that can happen realistically. And Camden, the borough, is, as I said, the Central London system is there as a support. It's a two-way sort of conversation but at each of these sort of intersections. So hopefully that gives you some idea where the best place to engage is. And these are some of the things that are happening. And yeah, there's a lot of it. It's all messy. And the thing is, all these things are happening at once. They're happening in parallel. So it's not about creating the structures and then developing the services. There are neighbourhood groups that are trying to build collaborations. I think Rashid's point was really important. There's a lot of collaboration and network out there in the sector where things are working really well that can be built on, and really should be. Those things should be supported to grow as well, because that's exactly what this seems to be looking at. So to date, at the system level, VAC have been drawing on our events like this to sort of feed into what's been happening, which is basically getting that strategy, help us to get the strategy drafted, and also build a working relationship across our 5 boroughs between voluntary sector organisations, voluntary sector umbrella organisations. VAC is also part of a test and learn group to embed the voluntary sector in the system, and this is with the King's Fund. So we're working together with our NHS colleagues that, from the sort of system level. And the focus that our North Central London subgroup in this process is resourcing and capacity for the sector. So, and that gets fed back up to NHS England. The Alliance Steering Group also works closely with NAVCA, our umbrella, who are our sort of voice at national level. So they communicate with NHS England particularly on things that crop up that are ridiculous sometimes. So it's all sort of aligned with, sorry, just flip slide. So these things are all kind of aligned with what's happening at that national level. And we have a consultant working with us. We learn from NAVCA. We have lots of materials to work with from other systems where the voluntary sector are actually operating quite successfully. So we've developed terms of reference about how we work together as the organisations across those boroughs. And at the moment, we're looking at a memorandum of understanding for working with the system. And this is where we need to start being able to roll these things out and get people's feedback and input from the rest of the sector. The Alliance, Voluntary Sector Alliance Steering Group is also part of the North Central London Community Partnership Forum. And that's where the patient groups, Health Watches, resident involvement and the community strategy come together with the voluntary sector strategy. And then obviously in Camden Borough, we have, there are voluntary sector places on related boards and working groups that Joe has already referred to, and there are voluntary sector organisations involved in the much wider partnership in terms of the neighbourhood working groups. There are neighbourhood working groups in each of those neighbourhoods, and I know lots of people have had emails from me encouraging them to join them. This is why. There are also strategic working groups around things like social prescribing, connectedness strategy, the neighbourhood type strategies. So yeah, there's a lot going on, all going on in parallel with this sort of whole governance thing as well, and creating some kind of infrastructure around this for the sector, and it is quite messy. So the challenges really are all about how we make it clearer and more accessible. So this really, what next? What does it look like? These are the things I think that we need to think about in terms of what we're doing in terms of looking at infrastructure to make things happen with the voluntary sector. So communication, clarity, staying in the loop between neighbourhoods, borough and system. And it's about knowing what those communication channels are. There needs to be more transparency. At the moment, things are very ad hoc. Accessible networks and points of access so the voluntary sector can engage in the right place for them. So really knowing what's going on in your neighbourhood, who you can connect with. And I would say vice versa. You know, this needs to also be happening within the statutory sector, in the public sector, so that council officers and NHS colleagues know where they can connect with initiatives that are already very relevant to this in the voluntary sector. Or they're actually doing the work, the type of work around that supports population health. So gathering voluntary sector input on key issues, and we're about to move into a period where we will be looking with NCL at the delivery plan for their voluntary sector alliance strategy. So developing the voluntary sector alliance then in Camden really, and the great aim for the Alliance for NCL is that it is really accessible and inclusive. But what does that actually look like in this huge world? So finally, there are some things that can do now with resources we have. We can use our members mailing list, which is a big list of just voluntary sector organisations. We have a list of individual members, but we have a VCSE list, which is always updated. So that would be quite a light touch way of being able to mail and get in feedback. We also do use our membership as a way of bringing in specific types of expertise, particularly around services that are provided in the sector. So as things progress, there will be things like working groups, might be thematic, might be about services, particular types of services. So the Voluntary Sector Alliance Steering Group really would want to, you know, be bringing lots of different people into these groups. We've got our newsletter we can use for, obviously, we would always use that to promote events, any funding opportunities. And I think perhaps until perhaps things change a bit, some of those things probably need more explanation and flagging up better. And we can use this forum for developing views on key topics. And I would really like to follow this up, I think, with looking at that delivery plan, and maybe that with Lizzie and Joe, because it's the, you know, the NCL level in Camden. So, and that delivery plan is about creating that access to things like commissioning, and you know, how do you do that? How do you design a contract around that, you know, gets a whole of different sectors working really well together, and enables, you know, quite small groups or the voluntary sector generally to engage with that kind of process. So that's the kind of, I see, I suppose, as the kind of trying to make things happen bit. And then we can all connect with neighbourhood groups or flag up what we're already doing in neighbourhoods in those groups. Each of those neighbourhoods has either a council officer or a CCG officer leading, and we can circulate those, the people to contact, to get involved those. And we have a real need as well to share updates across those neighbourhoods. What happens in those neighbourhoods? The challenges, for example, that might be being met, actually forming collaborations or partnerships, or bidding for a contract between a, you know, as a partnership. Those kinds of challenges need to be addressed in terms of how commissioning and resourcing actually develops in the future. So that's relevant to the delivery plan. And I'm sure there are lots of other ways we can do this. And I'm really interested here, other mechanisms we can make, a sort of set of ways that we, at this point, with no resources, I might add, actually, that none of this is being resourced. What are the things we can use to clarify that actually this is where you'll hear about what's happening within the system and what's relevant to the voluntary sector? So that marathon is over, fortunately. I'm going to stop sharing my screen so I can see people. Any questions?
Shall I go through some of the questions that are in the chat, Donna? Would that be helpful?
That would.
Okay. I've got a question here from Ola. I'm not sure who if it's to you or it's to Joe. It's about policies in the NHS, particularly around corruption, anti-corruption and fraud. Ola, is that related to Donna's presentation, or is that a hangover from Joe's presentation?
Oh.
Are you still there, Ola?
Yeah, I mean, I can't answer that anyway.
I can't see Ola. Okay, we'll move on to the next question. So from Shelley, how will the VCSE steering group be supported?
At the moment, just before Christmas, there was a grant with this third sort of cohort for £25,000, and that's been shared between 10 organisations to backfill our time at meetings, in effect. But you know, that ran out long ago. So that's really how we're being resourced at the moment. NAVCA are doing a lot. There's a lot we can use that's out there. But the next thing is to look at how we, you know, what do we need at borough level to work side by side, you know, all together on this, really. So yeah, that's still, you know, part of what we're looking at as well.
And in that same vein, there's a question here from Beeley that is, apart from support, how can VCSE influence the integrated care systems with their strategies that listen to the public?
I think that's precisely the sort of thing I'd want to, you know, if that's stuff coming from the people you work with and that has informed your strategy for what you're delivering, that stuff is really important to contribute towards the sector voice. And I think that's what we need is some way of getting that, you know, that's part of the communication system, I think, of getting those things. At the moment, it's very ad hoc. It does happen a bit, but it's very dependent on things that might come out of a neighbourhood working group or the sector generally. I mean, I use a lot of examples from things people are doing on the ground. And yes, the more of that, the better, really. And I wonder, is there a way we can bring that together? That's something to think about. But yeah, I'd love to see your strategy and look at, you know, where that, you know, how that kind of informs that voice.
Tosin, I'm going to bring you in if you can, just because there was somebody else that supported your question around the involvement of housing providers, social housing providers.
Yeah, we just again just looking at the slides so far that's been that was the two presenters have presented. Obviously social housing and thinking about health inequalities, there is a lot of links with those two important areas. So I was just, obviously I'm a community development manager within my organization, and we obviously have staff in place to offer support for people that have high needs, and obviously we've got care and support element to our organization as well. So I'm just wanting to just kind of is more of a point in terms of just not having obviously social housing on the on whatever the groups are, and also kind of in the planning and thinking about what their role as well and what they're doing, so that is also having that understanding of what they're doing in terms of helping to kind of achieve in terms of addressing health inequalities as well, because we do quite a lot as well. Yeah.
Thank you. Did you want to respond to that at all, Kathy or Joe? Sorry, Donna or Joe.
I think it's a great point, Tosin. I think that there's a role there at neighbourhood, but there potentially is wider than that. So it's, like I said, sort of throughout my presentation, this is all development. That's why we want to come and talk and listen particularly. So really fantastic point. But I think there is a role there at neighbourhood, but it's something we need to think about wider in terms of our partnership and how we work better with providers and organisations like yourself. So thank you. That's really sparked some thought. Yes, thank you.
I think there's been quite well, certainly with some of the neighbourhood groups, the one I go to there, I think Tosin, you've been to, you're on that in that group, but yeah, a push to get housing providers into those groups, because it is, yeah, so key in the whole picture.
And Ruth, you've got your hand up.
Yeah, thank you. Can you hear me?
Yeah.
Can you hear me? Yeah. I just wanted to point out that our project, very surprisingly, won an award from Camden. That's the first time in years. And when we came to access it into our bank account, there was such a, huge rigmarole of how to convert our way of working into their way of working, which was a business model, that we just couldn't understand the language they were using. The members, what's it called? The committee rooms of members were sending out the information to us award winners. And when I asked, how do we access the grant? She said, it's all in the instructions, but the instructions were just ununderstandable. So after a long rigmarole, we did get it. But, converting from a voluntary organisation into a business model of use, and the language that they used, which was all business terminology, just wasn't, it's just not right. That's got to be changed. Does anybody know what I'm talking about?
Yeah, I guess, Ruth, it's that kind of stuff with, language and how things are presented. If you, if we're going to all work together as communities and a voluntary sector and the NHS and the council, etc., then yeah, language has to be understandable to everyone and the way things are presented. But I think that's something.
But also the system they use is sort of, I mean, it was much easier with the big lottery. They
Right.
just put it in our bank account, you know. Thank you very much.
Yeah, funnily enough, I heard that there was the big lottery was one of the things that was looked at one point around the, you know, the way you sort of roll out funding. And I know there's I think there's quite a lot going on. The NHS are talking to their various councils, and obviously that's happening in Camden, about the way they fund the sector or support the sector. So there's a lot of learning going on from what's in existence.
Well, I'll tell you what was a surprise was that I found at the end of the process, when we finally got our money, they said that we were now on their system, and that if we wanted to be a contractor for Camden, we were all set up to do that. And I thought, well, I never asked to be a contractor, so I don't know what they're talking about. But if they are willing to have us, yeah, fine.
Things are changing, Ruth.
Okay, yeah. Cheers.
Okay, I think that's all of the questions in the chat, and there are no other raised hands. What would you like to do next, Donna?
Well, I think if anybody else wants to, does anybody else want to say anything about work that they might be doing, or and that could be anyone, could be the voluntary sector. There are people here who have some connection with the neighbourhood working from Camden. So no hands going up, no offers to nope. Okay.
What was the question? Could you repeat it, please?
Well, if nobody has any other questions, if anybody wants to talk about, well, I see Jessica's appeared. Okay. Some more context about what's going on, really, whether you're the voluntary sector or neighbourhood working. So Jessica, I'm gonna.
Yeah, thank you. Is my camera on? I think it is. Hopefully everyone can see me. Yeah, it was just really sort of to really a plea for voluntary community sector organisations to join in with the neighbourhoods, as Donna mentioned and Joe mentioned. That's the kind of the best way at this starting point as we kind of start to work through what this means to get your kind of voice and your opinions and set the direction of travel in that. So to join the kind of neighbourhood groups in your local area and start to influence things there, which will be then fed up into the wider kind of system groups and influence the kind of wider direction. So we can definitely kind of through Donna, we can definitely or through VAC or through myself or whoever, we can definitely start to connect people who aren't involved in those neighbourhood groups into those kind of groups to kind of join those conversations and meet other organisations in your area. I do appreciate what people have been saying about sort of wider kind of sort of cross-borough organisations and pan-London organisations as well, and I do think that thinking needs to happen on the kind of the best place to input on that, and I'll kind of take that away with Joe to kind of work through what that means as well, and hopefully, you know, connect back with you with some sort of firmer and clearer ideas and steer about that as well.
Thanks, Jessica. Any questions on that? No.
Yes, I have one. Yes.
Mm-hmm.
I am from Different Strokes. It's a national charity, and I'm just having a Central London group. It's a small group, but want to help work with a stroke association as well. But in the strategy, it's only focused on geographic, but it's not much of condition or cause-based organization can get involved. Yeah, and neighborhood, we cover the central London area, but it's how can we work together?
Yeah, that's good. Well, that's a good question. How engagement? I think, Joe, that's another similar to Lloyd's issue.
Yeah, and I'm more than happy to speak outside of here.
Yeah.
Yeah,
Okay.
that's fine.
Yeah.
You can get my contact details from Donna.
Right. Thank you.
Okay, Caitlin.
Sorry, I could not find that button to raise my hand for ages. So I do apologize. Thank you so much for the presentation. Very informative for both presentations. Yes, just wanted to say that I feel that the care navigation and social prescribing service is really that link between the NHS and the voluntary sector. I think Ruth mentioned that it was a little bit heavy on the NHS services and not many voluntary services in the plan. So I just feel that Age UK Camden is very much part of this, or should be very much part of this, as we run the care navigation service, and care navigators are based in the GP practices, and we've got new contracts coming up as well with the hospital. So just to say that we are here as well, and very much would like to be part of this integrated care system.
Okay, I think on that note, we've got about 4 minutes left. So in terms of next steps, I think we will, as Keith has already, I think, put in the chat, we will use this forum on key things coming up. And I think the next one might well be the delivery plan for delivery planning for the voluntary and community, working with the voluntary and community sector strategy. So I will be looking at that. I think we'll probably also start using our membership mailing list to get out some of the key things that are happening. Another thing, another focus, maybe that's for a forum. It would be great to have some kind of neighbourhood feedback point of contact. So from the different neighbourhoods, those, you know, we're getting information that can be shared across the system, and particularly when it comes to delivery planning on how the system works with us. So those are the things I think are probably some of the priorities at the moment. I'm very happy to hear from people. You can email me or put stuff in the chat now, or email VAC generally about other things that you think should happen here, or areas that you want to focus on, that we could, and who needs to be brought together for that. And we will do what we can, and perhaps pull in some of you to help us do it too. So I think that's all from me. And thank you for coming.